Live from Studio 5 in New York City, this is the News at 6.
Thank you very much for that. Let's continue to talk about it. Joining me right now, Sharda Sekaran, Managing Director, Drug Policy Alliance. Thank you for being here.
Thanks for having me.
Good topic, and it really affects a lot of people, as we know. Now, what's your take on this comparatively successful anti-smoking campaign? Is there a lesson to be learned there for, battling heroin?
Yeah, I think there are great lessons to be learned because with smoking and tobacco, we've dealt with it as a health issue rather than a criminal issue. And we've been able to see great improvements in terms of the number of people who are quitting smoking, reduced deaths, without arresting a single person. So it's a good use of public resources to focus on the health aspects.
On the health issue. That's an interesting point. Look, this problem affects a lot of young people, as you very well know. Right. What's a realistic plan, a realistic approach to try and reach them?
Well, I think young people, they really take a lot of, they take a lot with real information. When you give them a reality-based information instead of scare tactics. I mean, DARE, which was used for a long time without great results. People who graduate from DARE have the same likelihood, if not more so, of using illegal drugs than people who didn't do the program. So I think we need to look at the tobacco education, we need to look at sex education, and talk to young people realistically about drugs. We can't tell them blanket statements that aren't true, your brain on drugs type of scare tactics. There's a place for that, but it hasn't been proved to be very effective.
You're talking about a different approach here. We've done a lot of stories, including one in Massachusetts, and I know you're aware of this amnesty for heroin users if they agree to go into a program, a self-help program. What do you think about that?
I think these are great developments. We're seeing innovation as people move away from thinking about drugs as a criminal issue to talking about them as a health issue. These programs are happening in different municipalities where law enforcement are putting people into health services instead of arresting them. I think it's very promising. We've seen the country of Portugal, which about 15 years ago did that on a national level. Yeah. So where you're looking at drugs as a health issue, you divert the resources from the criminal system and instead you focus on trying to keep people healthy, reducing HIV, hepatitis rates, reducing overdose. You can do that with a health approach.
Sharda, are you optimistic in the next few years and down the road? What do you expect? Are we going to really, win some of this battle?
Well, I feel hopeful with the national tide that's turned towards taxing and regulating marijuana, dealing with it as a health issue rather than a criminal one. We've seen in states where marijuana has been legalized, there hasn't been a significant increase in young people using it. We want young people to make smart decisions and be cautious about their developing brains. But we also want to make sure we have smart policies that are based on health.
And I know you do a lot of great work. Good organization. Thank you for doing all of that. Come back again and bring us more updates, okay?
I look forward to
Sharda, thanks
it.
for being here.